Hello, everybody. Let's see, who do we have so far? I see Alina, I see Amarani, Zetlali, Amelia, Brianna.
Hi.
Hi. Okay, I gave everybody one more minute. There's a couple people I'm missing here, so let's see if everybody can log on before I get started. Okay. Two, three, four, five. Okay, I feel like that's enough time. Let's go ahead and get started, shall we? Okay, so for today's discussion, we will be discussing chapter 18, and this is just some basic chairside instruments and trace systems. So this starts on page 380 of your textbook. Some of the things that we'll be talking about here is we'll be identifying some parts of the instruments, describing how instruments are used, identifying categories and functions of dental burrs. Dental burrs are the little drill bits that we use inside of the dental drills. We'll be describing the types and functions of abrasives, explaining the various hand pieces and attachments, and describing the types of trace systems and color coding systems. Okay, so starting with some basic structural parts of dental hand instruments. The dental hand instrument can be single or a double end and is usually about 6 inches long. So it's important to know the different parts of these instruments, so it'll help you basically go along as a dental assistant. So we have one of the most basic instruments here pictured, and this is a picture of an explorer. So every instrument will have a working end. It will have a shank. The shank is kind of like the vertical aspect of the instrument where that is not the handle. And then we have the handle where you're actually holding on to. So there are different classifications of dental instruments. And by knowing the classifications, it's going to be easier to remember each instrument's name and function. So we'll start with the first one, which is the number of working ends. So there are 2 categories of working ends are single-ended and double-ended. So the instrument will either have one end, like a hand mirror, and that will be a single-ended, or a double-ended if you have like an Explorer or periodontal probe combination. So that's one classification. The next is if a dental instrument is classified by function, there is a cutting or non-cutting instrument. So also there are instruments used for certain specialties. So that is another classification. On the handle of an instrument is a manufacturer's number. Some instruments will have the name of the individual who designed the instrument, or it can be just a simple manufacturer's number, or it can be Black's formula. And Black's formula consists of the exact size and angulation of an instrument. So Black's formula deals with, there could be 2 different types of Black's formula. So the first is if you're dealing with like a chisel, a hatchet, or a hoe, there is 3 numbers. The first number and this happens to be a hatchet, or it could be a chisel. It's really hard to tell with this angle. The first number is the width of the blade, and that's the dimension that you see here in red. That's just the width of it, the cutting edge. The second number is the length of the blade. That's the dimension that we see in blue. And the third number is the angle of the blade in relation to the handle, and that's the dimension that we see in green, which is number 3, which is the angle of the blade. Now, if we're dealing with a instrument like an angle former or a gingival margin trimmer or something of that nature, it's going to have 4 numbers. So in that case, the first number is again going to be the width of the blade, which is that very, very small dimension that we see in red. The second number will be the degree of angle of the cutting edge of the blade to the handle. So there's a difference here between the first angle that we were talking about. So this degree of angle of the cutting edge of the blade to the handle, so this is the cutting edge of the blade. It's very, very small. And then in relation to the handle. The third number is going to be the length of the blade, and that's what we see here in this blue dimension here. Again, the length of the blade. And then the fourth number is going to be the angle of the blade to the axis of the handle. So there's 2 different angles that we're talking about here. The first one was this degree of angle of the cutting edge of the blade. And this, it's really hard to tell in this picture, but that blade has kind of like a diagonal angle. And that angle in relation to the handle is the second number. The fourth number is just going to be the angle of the blade, or the blade ends to the axis of the handle. So you can see that difference there between the angle number 2 and angle number 4. Okay, who could tell me what the end of the working end is called if it is blunt and serrated? What is that called? You know, I don't think I covered this, so I'm just going to tell you. It's called actually a nib. So I'll go back to the slide where I was supposed to tell you. So the working end of this dental instrument here is an explorer. The very, very, very tip of this explorer, the pointy edge, that's what the nib is called. So when we're talking about the working end, if it's blunt or serrated, that's a nib. Okay, so now we're going to talk about some cutting instruments. Hand cutting instruments are used in cavity preparations for actually cutting into teeth. So chisels are unique hand cutting instruments because they come in 3 different shanks to reach different areas of the mouth. And those different shanks are a straight shank, something that's called a Wiedelstadt, and then also a biangle. Biangle just means it has 2 different angles depending on what area of the mouth that you're working on. Hatchets have a bevel on one side. So it's very, very small, but there's a bevel here. There's also a blade on one side. And this is used to refine cavity walls and obtain retention in a cavity prep. So it's important for you as a dental assistant to be able to identify and know the use of each instrument. By doing so, you'll be able to assist the doctor in a more efficient and accurate manner. So if, like I said in the first introductory to the class, it's going to be your job to be one step ahead of the dentist. And by knowing what he or she is going to be doing next, you will know what different instruments you have on your armamentarium, and you'll be able to select that instrument. And it might take some time for you to get used to the doctor's needs and wants, but at some point you will become like one mind. And you'll be able to anticipate your doctor's needs by looking at the cavity preparation and go, okay, he or she is going to need to refine that cavity prep. So I'm going to grab him this chisel, or her this chisel, or this Wiedelstadt. And so that's what we're talking about here. Just by knowing all of your instruments, you'll be able to assist your doctor in a more efficient manner. So this is what a hoe looks like. So I don't know if any of you have ever had to do any yard work. I've had to do lots of yard work, especially as a teenager. But a hoe, like for cutting weeds, right? It's shaped very much like this, and it has this kind of 90-degree angle. And this is used to smooth and shape the floor of a cavity preparation. So I'm going to go to this picture here really quick. So this is an occlusal view of a tooth. This looks like a premolar. And there is a cavity preparation here. It's basically a hole that was probably cut by some drills or dental, I shouldn't call them drills, they're actually called burrs. And then maybe we use some chisels and things to make these angles here. So the floor of the cavity preparation is this plane that we see in the middle. And by using this hoe, where did the hoe go? There it is. Using this hoe, we kind of use it like in a rake manner to kind of smooth this cavity preparation or the floor of the cavity preparation. So that is what a hoe is used for. Okay, gingival margin trimmers have a curved blade. And I don't know if you can kind of see in this picture, but there is a slight curvature in this blade here. So this is used for beveling the gingival margin wall of a cavity prep. And it has an angled cutting edge as well. So it will create a bevel in a cavity prep. We have angle formers here, which define point angles and sharpen line angles. And you're probably wondering what the heck is a point angle and what is a line angle? Well, in this picture, we're going to come to again. So a line angle, you can think of a line angle in two different dimensions. So it's where two points come together. So for example, if we look at this line here, as it intersects with this line here, this intersection here is a line angle. If we look at this plane here in the middle, which is the floor of the cavity prep, and we look at this plane here, which is a wall, it kind of comes in like a 90-degree angle like that. So this point here, or this line here, I should say, is a line angle. So anytime you have two dimensions that come together, we have one dimension and two dimensions, right? This point here where my arm is intersecting with my fingers, that is a line angle. A point angle we can think of as being in three dimensions. So we have this line angle here, right? And now as we go vertically up the tooth, the intersection of these three lines, this is a point angle. So we have a point angle here, a point angle here, a point angle here, and a point angle here. Everybody see that? So that is a point angle on the very bottom of the cavity prep floor. What about this intersection here? Is that a point angle or a line angle? Who can tell me?
It's a line angle.
Line angle, and it kind of depends on how you look at it. If we're just talking about these two lines here, then yes, that is a line angle. But if we're talking about these two lines as it intersects with this vertical line, then that is a point angle. So that's just the difference between those two. Okay, we all clear with that? Okay, all right, so let's go on to this next one. Now we have what we call excavators. So excavators can be either a blade, which is what we see in this top image, or it can be a spoon, which we see in this bottom image. And it's kind of hard to see, but this isn't like a flat disc. This is almost like a curved or cup shape, sort of like a spoon. And what excavators are used for are to remove carious material from the tooth. Carious material means cavities or tooth material that has decayed. So it's kind of mushy. And so we can use that to scrape those areas out. Okay. It's also used to remove excess cement. So if we cement a cap onto a tooth, you can imagine if we fill a cap with cement inside and we fit it over a tooth and we squish it down, there's going to be excess cement that kind of forms around the tooth. And so we can use something like a bladed excavator to kind of trim off that excess cement and make it smooth so that there's no excess or flash underneath. Can also be used to tuck in a rubber dam, and we'll be learning how to place rubber dams later on in this course. And it can also be used to pack a retraction cord. Now, there's certain instruments that are made specifically for packing retraction cord. We'll also learn how to do that. But if you don't have one of those instruments, you can use a bladed excavator to pack retraction cord. It will work the same way, or even a spoon for that matter, if the spoon is kind of flat enough. Okay, so who could tell me the name of the cutting instrument that is used to plane and sharpen enamel and dent in walls?
A chisel?
Good job, a chisel. Who said that? Alina, good job, Alina. Yes, it is a chisel. So those can plane and shape enamel and dent in walls. So that's basically, these are the walls here, this vertical planes here. So we can use a chisel to kind of, the dentist will kind of use this in a motion like that to shape those walls. Good job, thank you. All right, so now we're going to look at some non-cutting instruments here, and we'll start off with the most basic examination instruments. And so the mouth mirror is one of them, and there are three types of mouth mirrors. There is a plain mouth mirror. There is a plain or a regular surface mouth mirror is what they're called. We have a front surface mirror and a concave surface mirror. So with the front surface mirror, you'll get what we call a ghost image. And that's it's not really clear. So a lot of dentists will prefer what we call a concave mirror, and that prevents that ghost image from showing up. The most common size mirror is a size 4 or a size 5. Size 4s are usually used in pediatrics, and I think they even make a size 2 or 3 for that. And then for adults, we would use a size 4 or 5. Explorers come in different variety of angles and different ends in order to access various parts of the mouth. So it's used to detect irregularities. So this is yes, that's an example of a explorer. Some of these explorers have what we call a right angle. So this is a right angle explorer. We have a shepherd's hook, which is what we saw in the very beginning. So this is a shepherd's hook. There is also one, and I believe there's a picture in your instrument pocket guide, and it's called a pigtail, and it basically just looks like a little curlicue or a little pigtail. So that is some different types of explorers that we have. Cotton pliers, what we have here, is used to remove, to transfer, and to retrieve materials from the oral cavity and or drawers or cupboards. So their handles are either locking or non-locking. So this one happens to be a non-locking one. If you have a locking one, there'll be like a little peg here with a hole on the other side so that when you squeeze them together, they kind of lock. And tiny tips can be straight or they can be angled depending on the type of cotton pliers your dentist likes in their office. The periodontal probe is what we see here with the plastic black handle. This is used to measure the depth of the gingival sulcus. So what the gingival sulcus is the area between the bone and the gum tissue. So they'll kind of sink it in between the tooth and the gum tissue until it drops and hits the bone. And they'll measure that in millimeters. And there's little graduated markings here on the very tip of that periodontal probe. And they'll use that to measure the pocket depths. An instrument called an X-Pro is a combination of a periodontal probe and an explorer. So at one end, you'll have a probe. And then on the other hand, you'll have an explorer. So that's a very common one that we see on a lot of basic kits. Another type of non-cutting instruments are instruments that are used after a cavity has been prepped. So after all the cutting is done, these instruments are used to place and shape restorative materials. So the instruments are used for placing bases and liners, also placing amalgams and composites, and contouring and smoothing final restorations. So a plastic filling instrument is not named because of the material that it's made out of, although this one here, A, happens to be made of plastic. But it's used, the name plastic filling instrument is used to describe the materials that it's going to be manipulating. So at the end, for example, this B instrument here, the very tip of this is a plastic filling instrument, not because it's made of plastic, because it's not, it's obviously stainless steel, but we'll use it to manipulate plastic materials like composites. Composite instruments are used for placing, condensing, carving, and contouring and burnishing composite materials. So this end of this composite instrument is called the ball or ball burnisher, and that's used to shape and smooth composites. Usually these composites are like in a type of putty material where it's manipulatable until you cure it with a blue light or a blue UV blue light until it becomes hard like plastic. Here's another type of plastic instrument here. Another non-cutting instruments is an amalgam carrier. So as we go into Den 170, which is dental procedures, we will learn how to use an amalgam carrier. So these are used to carry and dispense amalgam, and they sort of work the same way that an ice cream scooper works. So we have two hollow ends here. There'll be a full size here, and then usually a smaller size. So they usually have two different sizes of cylinders here. So amalgams come in, when you mix them in the amalgamator, the shape of it is like almost like I should say the consistency is like putty. So you put that in this little well, and then you'll use this hollow cylinder to kind of scoop parts of the amalgam, and then you'll hand it to your dentist, and they'll put this part inside of the cavity preparation, and they'll push down on this little handle. And what that does is it pushes the filling material out. So that's the way a amalgam carrier works. Amalgam condensers are used to pack amalgam into the cavity preparation, and these are just some different sizes of amalgam condensers. And here we have these different shapes that kind of correspond to them. So they almost look like little packers or condensers. So once the dentist places the amalgam using this instrument, the next instrument that you'll hand them is one of these amalgam condensers. And so they'll use this to kind of push or pack that putty-like amalgam into the cavity preparation until the entire cavity preparation is filled up with amalgam. Carvers are used to remove excess restorative material. They can also be used to carve wax inlays and onlays. And so these have different shapes and sizes. This one here happens to be called a discoid cleoid, or a cleoid discoid, depending on how you like to say it, potato, potato. So this top here is almost like a spade shape. That is the cleoid section of it. And it's kind of like a spade shape, but it's also has sharp edges around it. It's used to carve excess material. A discoid is sort of the same thing, but instead of that spade shape, it's more of a disc shape. Okay, this one happens to be, I haven't used this one in a while. It's off the top of my head. I can't think of it right now. I believe that one's called a Wiedelstadt, but let me double check on that for you.
Is it not the Hollenbach?
Hollenbach, thank you. Thank you, it is the Hollenbach. So that is a carver that's also used for mostly amalgam, and it's used to kind of carve the excess tissue, the excess filling away from the interproximal areas of the tooth. Thank you for whoever said that. It was at the tip of my tongue, and I couldn't remember it. Okay, so these are another type of non-cutting instruments. These are burnishers. These are used to smooth restorations and shape matrix bands. We'll be learning how to place a matrix band later on in the course. And so these have different ends. This one happens to be called an egg or a football, some people like to call it. This is a ball burnisher. And then this one here is called a beaver tail. Sort of looks like a beaver tail. We also have one here that looks sort of like an acorn. And so this instrument is actually called an acorn. The proper name for it is an acorn carver. It's not a burnisher, it's a carver because it has little sharp angles here that it's used to carve. It's usually used to carve the central groove anatomy of like an occlusal filling. It's popular for smoothing amalgam or composite restorations. Okay, other non-cutting instruments are files that are used to trim filling material. And then finishing knives, that's also used to trim excess materials, especially from the margins. It's funny that it's a non-cutting instrument because it does have a cutting edge, but it's not used to cut the tooth necessarily. It's more used to cut the excess composite or excess filling material. Some other non-cutting instruments are miscellaneous instruments like spatulas that we use to mix cements. Articulating forceps, they almost look like little tweezers or little holders that we use to or to hold articulating paper. And articulating paper is basically just like a little thin strip of carbon paper that patients bite on. And it's how we measure occlusion to know if the filling that we just placed is interfering with their bite. And if it is, it'll actually mark that filling material in blue or red ink. And so the dentist will know exactly where to adjust or smooth that filling material. There is also scissors that are used for different things, for cutting bleaching material. They're used for cutting stainless steel crowns, articulating paper, different things that we use scissors for. So all instruments should be properly cleaned and disinfected as soon as possible after each use. If they're not able to be cleaned right away, they should be pre-soaked in a solution to prevent the debris from drying on the instruments. That just makes your life really hard to try to get those filling materials off of the instruments. So the instrument should be cleaned in an ultrasonic bath or similar solution. Hinged instruments should be cleaned in the open position and should be lubricated as appropriately. So these are things like pliers, scissors, anything with a hinge on it. After cleaning for the appropriate amount of time, the instrument should be rinsed and dried. And then once they're dried, they should be sterilized in an autoclave and then stored once they're dried from the autoclave. All instruments should be carefully inspected before use and properly it should be inspected for proper functioning parts. You have to make sure that these things aren't broken. You have to make sure that everything's working to specs and that there's no excess material like dried cement or dried amalgam or dried composite material on them. So who can tell me which type of burnisher is popular for smoothing amalgam or composite restorations?
Is it the ball finisher?
Yes, a ball burnisher is one of them. And there is another one that I went over and had its own picture, had its own slide. Remember what that
the
was?
acorn. The acorn.
Yes, the acorn. So both of those, the ball burnisher and acorns, are used for smoothing amalgams or composite restorations, whichever ones you happen to be working with. So these are rotary instruments. So these are basically burrs, and these fit into the dental handpiece. We don't call a dental handpiece a drill, we call it a handpiece. And so similarly, we don't call them drill bits, we call them burrs. So materials that make up the burr are either steel or tungsten carbide. Sometimes you also deal with burrs that are made of diamonds. You will find burrs not only used in chairside, but also in dental laboratories. So there's certain burrs that are designed to go inside of the mouth, and then certain burrs that are used to be like, we call it table side or lab side, or we kind of work with burrs in our hands instead of in the patient's mouth. So the use of the burrs is as follows: for cavity preparations, for finishing and polishing restorations, surgical procedures, and dental appliance adjustments. So whenever you're making a dental appliance like a mouth guard, a retainer, a bleaching tray, a lot of the times you'll need to smooth the edges and the angles so that they're not sharp. So we have the different parts of the burr. We have the shank, and the shank is designed to accommodate the dental handpiece. The shank is what actually fits inside the handpiece. We have the neck of the burr, which supports the head of the burr, and the head is usually the cutting edge of the burr. There's three different types of shanks. We have a straight shank, and this one usually is longer, and this will go inside of a lab handpiece. So like a straight handpiece that's not really used to go inside of a mouth. It's used to be straight handpieces are usually used for like trimming and appliance outside of the mouth. We have latch type shanks that usually go on a slow speed handpiece. Slow speed handpieces are usually used to smooth or finish or polish restorations. And they're also used to excavate decay. So if we have a latch type shank with the round burr like this type of burr is used to remove only decayed tooth. So only if the tooth is weak or mushy will it remove that material. It doesn't move fast enough to actually cut healthy tooth structure. The next one is a friction grip shank, and this is used on what's called the high-speed handpiece. So these are the type of handpieces that are designed to cut tooth structure. So when we make those cavity preparations, it'll be used from a friction grip shank, which is always going to be on a high-speed handpiece. So the burrs are divided into categories according to their use. The cutting burrs are separated into different shapes and sizes. These burrs are numbered, and students should learn the numbered ranges. So there's actually going to be a homework assignment that you'll be, it'll be like a week-long type of assignment where you'll put together like these different burrs, and you'll have to know exactly what they all do. Diamond burrs are also used for cavity preparations and finishing restorations. So those diamond burrs actually cut they cut teeth really, really well, almost like butter. So they're used to make really nice, sharp line angles and point angles and really smooth cavity walls. The finishing burrs come in different shapes and sizes and are used to smooth the restorations. Surgical and laboratory burrs may look similar, but the surgical burrs are used in the mouth and the laboratory burrs are used on fixed and removable appliances. Physiotomy burrs are extremely small and are usually used to explore the occlusal surface to treat and diagnose while maintaining tooth structure. So if a person has like, let's say they have really deep anatomy, like really groovy anatomy, or like sharp grooves in their teeth, and they're starting to get decay. A lot of the times physiotomy burrs, and they kind of look like this, but they're very, very, very small. This isn't a physiotomy burr, but they're usually in that shape. They're a lot smaller. They're used to just kind of explore the tooth structure, and it'll actually remove any starts of decay so the dentist can go ahead and put in a sealant or a filling. So it's kind of like a borderline between a preventative measure and actually fixing decay that has just started. There are abrasives that are used for cutting. The shapes that categorize abrasives are discs, points, and wheels. Non-bladed instruments are used to finish and polish restorations and appliances, and they can be made out of rubber, they can be made out of stone or sandpaper. Mandrels are like rods that have different lengths that are usually used in a slow speed latch type handpiece. Um, those are those can be used in a latch type, a friction grip, or a straight handpiece, and they're used to hold discs. Um, the discs can be attached to a mandrel, and the discs are used to polish, smooth, and adjust restorative materials and certain dental appliances. Stones are used in the laboratory and are often available in many shapes, sizes, and grits. So these are things that are used for cutting, for polishing, and for finishing amalgam, gold, composite, and porcelain restorations. So depending on the type of stone that you're using, so for example, this happens to be a white stone. We have, oh, here they are. This is a better representation. We have a white stone here. This is like it's made out of, I believe, some type of aluminum. And these are used to, they can actually cut tissue and they can smooth it at the same time. Brown stones are very soft, and those are used only for polishing. They will not cut tooth. And if you try to cut a tooth with the brown stone, it'll actually fall apart in the mouth. And then we have different other stones that are almost made of rubber, like these blue stones and these green stones. Those are also made for polishing. Rubber points are used for polishing, and they're also used for adapting or defining anatomy and restorations. So these are the type of rubber points that we're talking about here. So all of these here are used for polishing, and they're almost made of like an eraser material. And so as you polish teeth, the little bits or parts of the rubber will actually get stuck in the microscopic holes that are in like a composite material, for example, that make it rough or sandpaper-like. And it'll fill those holes and it'll make it so it's glass smooth. And so that is what rubber points are for. So who could tell me what type of burr is used to open the cavity and remove carious tooth structure?
So
I heard a round burr, and what else?
I said in cone.
Cone, that's another one.
is it
So both of them are right. So round is used for opening the cavity, and also for removing carious tooth structure. A cone shape is sort of the same thing as a round. It just happens to be a different shape of round. So depending on what your doctor is doing, usually cone shapes are used for, because round shapes are if you think of like a round or a spherical shape, that'll kind of make like a smooth opening. A cone shape, basically made of like a cone, right? So that will actually put undercuts into the cavity preparation walls. Those are mainly for placing amalgam fillings, because amalgam fillings are metal. Metal does not bond to teeth. It has to be retained inside of the cavity preparation via mechanical means. So we have to lock it in place with undercuts. And so as we do amalgam fillings in class, I'll talk about this in a little bit more depth, so it'll make more sense. But yes, both of those answers are right. Yes.
I have a question. So when you were talking about these, the rubber, yeah, the rubber ones, the
Huh?
rubber wheels, rubber points.
Rubber point? Yeah.
Yeah, I wanted to know, how often does the dental office use these? Because I don't ever recall seeing those.
Um, I would say 90 to 100% of the time, if they're doing composite restorations properly. And the reason why I say that is because if you don't polish composite restorations, they're like sandpaper, and bacteria love surfaces that aren't smooth because it has a way of attaching to them. And so if you don't polish a composite and it's left like sandpaper, if you think of sandpaper and you look at it like in a microscopic standpoint, they're basically little holes inside the surface that make it rough. So bacteria will set up shop inside those little holes. they'll undermine that nice, beautiful composite that was just placed, and they'll actually go underneath the composite and re-decay the tooth. So for that reason, it's very, very, very important to polish the tooth, not just for the patient's comfort, because we want to make it nice and smooth and glass smooth for them, but also because we don't want that bacteria to stick. So if you've been to a dental office that isn't using those, I probably wouldn't go back to them again, because that restoration is likely to fail in the future. I would say that for every composite material that is not polished, you can expect for it to fail in the next year or two. Plastic white fillings really only last 5 to 7 years as it is, even a well-placed composite material that's properly polished. But if you don't polish it, you can cut that lifespan in half. Does that make sense? Okay. All right. So now we're talking about some dental handpieces, and these are used for removing dental decay. They can be used for preparing the tooth for restoration, for polishing, and for finishing restorations. What I mean by finishing, that's cutting off the excess, polishing it so it's nice and smooth. And then the difference between these two is one is for polishing and finishing dental restorations, and one is for actually polishing the tooth, like when we go get our teeth cleaned. They can also be used to cut, finish, and polish dental appliances, or trim models and trays. So the different parts of the handpiece are, one is the working end. This is the head of the handpiece. This is where the burr is inserted. We have the shank of the handpiece, and we have the connection end. And I wonder if I have, yes, I have a picture here. So the head of the handpiece is here. This is where the burr is inserted through. We have the shank of the handpiece. And then I think the other one was a handle of the connection end. Oh yeah, the connection end. This is the handle of it. The connection end is the part that goes inside either a motor, something like this, or it'll fit directly inside a dental handpiece hose. All dental handpieces, well, I shouldn't say all, most dental handpieces are pneumatic, meaning that they are air powered. So there is always a compressor. There are some dental handpieces that are electric, and these are usually used like in laboratory settings. Sometimes you have electric handpieces that are used in the mouth, but these ones are actually very expensive, and they can be problematic just because in the mouth is very wet, and we introduce moisture into electric handpieces, they tend to break. So almost all the dental handpieces that go in the mouth are pneumatic. And then they're also high speed. High speeds are used for cutting into tooth structure, and low speeds are used for removing decay, or for finishing or polishing. So the general guidelines for maintaining and sterilizing a dental handpiece are: one, while holding a handpiece, while the handpiece is still attached to the tubing, you want to flush it for 30 seconds. So what that means is most of the tubing will have a water connection into it. When we get into dental procedures, I'll show you there's a little switch underneath the tray, and that little switch will actually send water through the handpiece without turning it on. That'll just basically flush the whole thing out so that no debris or blood gets stuck inside the lines. And then after that, you want to remove the debris by scrubbing that dental handpiece with some type of abrasive, like a Brillo cloth or something like that. And then that's because we have to get all the tooth debris or blood or tissue debris off of the handpiece. And then you want to lubricate it using manufacturer suggested lubrications. We have a lubricating machine / cleaner inside the dental lab in the classroom. So I'll show everybody again how to use that. We'll sterilize the handpiece either in a dry heat autoclave or a steam autoclave, and then we'll lubricate it if necessary. So depending on the type of lubrication that you're using or the type of handpiece, it may need to be lubricated again after, although most of these newer lubrications don't require this. And as soon as it gets sterilized, it's in a sterile package and it's ready to be opened in front of the patient and used. So air abrasion units and micro etchers are sort of like little sandblasters. So an air abrasion unit reduces the need for anesthetics and drilling with dental handpieces. So this is if somebody has a very, very, very tiny cavity, we can actually sandblast that mushy part of the tooth out of there to kind of open it up, and then we can fill cavities that way. But those have to be very, very small cavities. There can't be any healthy tooth structure in the way, which is kind of rare. Micro etchers are smaller versions of the air abrasion unit, and this is used for intraoral sandblasting or dental bonding. So let's say we have a crown, the crown that fell off. And so there's lots of times there's cement or debris that's still in there. So a micro etcher can be used to, it's like this little sandblaster. It almost looks like an airbrush. If any of you have ever seen an airbrush, like what artists use to paint paintings, it looks like that, but instead of shooting ink and air out of it, it shoots basically sand out of it, and it can sandblast the inside of crowns. It can also etch them to make them, it puts little microscopic holes in them so that they can bond easier. Also, like let's say somebody has braces, and sometimes those little brackets, those little metal brackets fall off. If you've ever had braces and ate something that you weren't supposed to, you know what this is like. The little brackets fall off. You have to go to your orthodontist. And what they'll actually do is they'll use a micro etcher, which is a little tiny sandblaster, and they'll sandblast all the excess cement that's still on there. And then they can actually rebond it to the tooth that way. Tray systems are something that you'll use to have or carry all of your instruments in. The most common is a preset tray systems where we have instruments and some auxiliary items that are on there. This is placed on the tray in order of use during a procedure. And so most of the time, especially in your downtime or at the end of the day or at the start of the day, at some point of the day, you will go ahead and set up all your trays for all of the procedures that you have to do that day or the following day. And so the way you set up a tray is you want to place every instrument in order that it'll be used. That'll make the procedures go a lot quicker and a lot more efficient. There's other systems like cassettes and things that can be used. Cassettes are nice because they can go directly into the ultrasonic bath, and then from there rinsed and put directly inside of the autoclave. So whatever type of tray system you use, they're all used to transport instruments into the treatment rooms, through the sterilization process, and into storage. And it also keeps the instruments for each procedure together at all times. Color coding makes it easy to identify instruments and trays. So it's important that the materials used for the color coding is autoclavable and durable. So types of materials used for color coding include plastic rings. Sometimes there's rubber rings, like little tiny rubber bands, and colored coding tape. So let's say we have an instrument kit that's used for composites. We have another instrument kit that's used for hygienists, like cleaning instruments. Another one that's used for root canals. Another one that's used for crowns. Another one that's used for amalgams, right? And then they all get jumbled up inside of the ultrasonic bath, and then it's your job to sort them out. So you want to have some type of color coding system so that you can very easily gather all the reds, all the blues, all the yellows, all the greens, all the pinks, put them together and put them in their own little kits. There's other ways to go about doing this. Some offices use they almost look like little pencil boxes where you can keep all the instruments separate. I like that idea because even though you have color coding systems, sometimes it still becomes a chore to have to sort all of your colors. It's easier to just have them all in this little pencil box holder. Some offices use a hair ties, like those. I don't know if you've seen those little hair ties that have balls at the end of each end. So you'll wrap them up, and then you'll use those balls to kind of hold your instruments together. I also like that because they're easy. Let's say you have a lot of instruments you can kind of put together, and you can jumble them and wrap them all together and put them in the ultrasonic bath, rinse them, You have to take the rubber bands off before you put them inside of the sterile bag, but then that way they're already sorted and ready to go. So here are what some of these color coding systems look like. These ones are the most common ones. These are like little rubber bands, but they're very durable. So they can be autoclaved many times before they fall apart. And so some of them will have, some of your instruments will just have one single color, but after you start running out of colors, a lot of times you have to mix the colors up so that you have different combinations of them. So let's say all of your composite instruments will be blue and yellow. Maybe all of your endodontic instruments will be green and white. And then you'll have other instruments that are kind of color coded that way. Any questions about this at all? All right, so that's all that I have for chapter 18. So let me just go over what is due for tonight, and then we will wrap it up. So what is due tonight? The first thing you have is your spelling test for week 1. So this is a 10-minute timed test. You only have 10 minutes to finish this one. So don't sit down and take this one until you have 10 minutes of non-interrupted time to go ahead and take it. This one is due by 10 p.m. and I will be using this for attendance. So please get it done before then so that you're not marked absent for some dumb reason like not turning in an assignment on time. There's no notes, books, or internet source that you should be using for a test like this. There's also a quick check or group of quick check exercises that you can find in this folder here. There's just a few of them. They shouldn't take you too long. It shouldn't take more than 30 to 45 minutes to complete all of those, but those are due by midnight tonight. I want you to read chapter 18 if you haven't already. It should take you about an hour to do that. And then none of you that are on this call should have to worry about reviewing this lecture or this discussion because I will be recording it and posting it, but it will be up on the course site in case you want to go back and go over again something that I talked about. And then the next thing is to begin your Burr review assignments. So the due date for this is going to be on the 16th. Which I believe is on next Wednesday. So you'll have a few days to get this done, but what you're going to be doing is you're going to be selecting one of the following choices from this section here, and you want to create a study tool for reviewing carbide burrs. And this is things from, it's in your book, so from pages 397 to 400. There is going to be these little boxes of these different carbide burrs that are used for different functions. And these are the ones that are in these little green boxes that you see. So what you're going to be doing, you can pick one of these choices. You can either create a set of flashcards using Quizlet or Cram or a format of your choice. Or if you want, you can create physical flashcards. You'll either draw this in if you're a good artist, or you can take pictures of it and print out those pictures and paste it onto your flashcards, take pictures of your flashcards and send them in that way. Another easy way of doing it is creating a PowerPoint presentation or creating a poster, sort of like putting all of your flashcards on one poster, taking a picture of that. Regardless of which assignment that you choose to do or which option that you choose to do, you need to include the following for all 9 carbide burrs shown on page 397. So on 397, you actually have a picture of all of them in one. You need to have a sketch or a photo for each burr. You have to have an explanation of the functions of each burr. And you also have to list the number ranges for each burr. For example, on page 397, there is on the upper left-hand corner, there is a round burr, and that goes from size range 14 all the way to size range 10. So you have to include those size ranges. Why do I say that you need to create a study tool, do you think? Oops. Well, because there's going to be a test on these burrs. And so you want to create something that you can study off of. Now, in the test, I'm not going to, you're not going to be expected to know each size for each burr, but you will be expected to recognize the size ranges. So on the test, there'll be something like which burr goes from size 14 to size 10, or which one goes from size 56 to size 58L. And you should be able to recognize those size ranges and be able to choose the right choice. Any questions on that so far?
So we're using one of these, right, to make our study guide? Or like one of these little green boxes, right?
Page 397 to 400.
Right. Oh.
So on page 397, there's all of the 2, 4, 6, 8. There should be 9 burrs here, right? And on the following pages from 397 to 400, we have explanations of what each one of them do. And those are the things that you need to include.
Okay.
Let me, sorry, I didn't even know if you guys are seeing any of that, but I was saying. So this is the burr review that you're going to be using. You guys see my screen now, right? So there's some things that you'll have to kind of keep in mind. There are some corrections that need to be made to the names of the burrs on page 397. So I want you to make these changes in your text. So go ahead and write on your textbook and use the terms that I have indicated as corrections for your assignment. So for example, instead of, you should be using plain, fissure, straight, or instead of a plain fissure straight, it should read a straight fissure plain. Instead of reading a crosscut fissure straight, which how it reads in the book, it should read a straight fissured crosscut. Instead of a plain tapered fissured, it should read a tapered fissured plain, and so on and so forth. So the corrections on page 399 is instead of a plain fissure straight, it should read a straight fissured plain, and a plain fissured crosscut should read a straight fissured crosscut. So a burr cannot be both plain and crosscut at the same time. It's either or. On page 400, the correction should be a tapered fissured straight should read a tapered fissured plain, because a burr cannot be both straight and tapered. Tapered fissured crosscut is correct as it reads, but most of these corrections should be made. I guess the people that made this book probably weren't dental assistants, or maybe they were dental assistants too long ago, but in order for it to make sense, I need you to make these corrections. And as you kind of go through it and create your assignment, you'll realize why they make sense, why I want you to name them that way. Any questions with this assignment at all? Okay. So these are the things that are expected of you for the end of tonight, except for the burr review assignment. That's not, I want you to start on that tonight, so that you're not leaving a huge assignment like this to be due like in a day or whatever, but it's not due till the 16th. And then also study for your chapter 17 tests. That test date for that will be on the 14th, which is on Monday. So a good way to study for that is to not only use the video lecture, or not the video, the video lecture that I believe Rhonda recorded yesterday, and then also the PowerPoint slides. And then yesterday there was also basically on all of these content folders, there will be at the very bottom study materials. So if you open chapter 17 study materials, this will at least have you familiar with all of the terms that you'll be responsible for knowing for the chapter 17 tests. And then as far as everything else, you'll kind of refer to your reading in the book, and then also the video lectures and the PowerPoint slides. All right. Anybody have any questions before we wrap it up? All right, so if you don't have any questions for me after class, you are free to go. Have a good weekend, be productive, be safe, and I will see you all again on Monday. All right.
Bye, thank
Bye.
you.
Thank you.